It's been an unexpected pleasure to sit through a whole hour's meeting of people in the industry talking about my subject. I hadn't anticipated it, and it was a pleasure. And I have to say, it wasn't like that when I began. We can date with unusual precision exactly when nutrition became a public health issue. It happened on the 3rd of July, 1983, which was when a report from the unfortunately named NACNI Committee, Nutritional Advisory Committee on Nutrition Education, was leaked on the front page of the Sunday Times. The government had commissioned this report, thought it was going to get a committee advising people with new recipes on healthy cooking, and instead what they got was a report that was a critique of the unhealthy British diet. They tried to block it. They made the author of it, Professor Philip James, rewrite it 13 times. When, after the 13th draft, he finally realized that they were never going to let him publish it, he realized he had to leak it. And he leaked it to friends onto the front page of the Sunday Times. Nothing happened. So he leaked it again, this time the whole report to the Lancet. And suddenly, nutrition became not something for pregnant women and young children and sick people. It became a public health issue. And we had a flurry of reports and interest and engagement, of which this meeting is a very fine example. But in the first stages, when people began to respond to nutrition as an issue, what they proposed was better labeling and nutrition education programs for final consumers, usually led by the government. If you read, as I did in those days, report after report after report written by expert committees on nutrition, there would be hundreds of pages on scientific research, and then a slim bit at the end on policy, what to do about it, and the policy recommendations were always the same: better labeling and consumer education. And this was not just in the UK. We've recently had 3 studies of nutrition policies around the world over the last decades, done by WHO Europe, 50-odd members, OECD, developed countries, 36 members, WHO globally, almost 200 countries, and the results came out always the same. Nutrition policy all over the world, whether you were talking about poor countries or rich countries, always came out the same: better labeling and nutrition education for final consumers, preferably done by the government. For those who are interested in nutrition, it can be transformative, change their lives, their diets. But if we look at this strategy of trying to get consumers to change their behavior, to choose healthy foods instead of unhealthy ones, we have to recognize that as a public health issue, it has been a failure, a total failure. And the evidence for this is a global obesity epidemic all over the world, in poor countries and rich countries. Ever since the last 1980s on, obesity rates all over the world are going up. Worse in poor countries because they have a double burden of malnutrition, not just obesity, but we do. But this has been a common pattern all over the world of a limited nutrition strategy failing and obesity rates going up. It's gradually recently come to a recognition that this strategy is not working. Education is desirable. People have a right to know what good nutrition is, but it clearly is insufficient as a policy for change. Why is this? Part it is that consumer nutrition education messages are drowned out by food advertising. I've done research myself on the numbers, sat in the British Library, did all the calculations in the 1980s. Absolutely overwhelming. No ratio worth comparing between advertising and health education budgets. Sue Dibb, who unfortunately can't be here, has done the same. We did a lot in Action Information on Sugars, on sugar advertising. Nutrition education is simply drowned out by food advertising. But there's a second reason, and there's a second reason that people in the nutrition field are most reluctant to admit. And it is that the vast majority of people in this country are not interested in healthy eating. Doesn't mean they're all actually against it. Some people are for it in principle, but they have other priorities in their life. There's the taste of the food, the price of the food, the convenience of the food. The brand loyalties are something they've consumed for a long time. What the spouse and the kids will tolerate. In that list of priorities, nutrition, healthy eating often comes relatively low. But then there's another sector of society, and we can't put numbers to this because people don't always give honest answers when you ask them, who actually reject the whole idea of healthy eating. Who the hell are you to tell me what to eat? This is my space, get out of it. They don't treat healthy eating advice as helpful, they treat it as harassment. You're telling me what to eat, get lost. And those are some of the reasons why nutrition policy has been so ineffective for so long. Happily, things are beginning to change, and we can see this. We've begun to recognize, move beyond education or behavioral strategies toward reformulation as a strategy. Think about it conceptually. We're changing food as well as changing people. We're moving beyond a behavioral change strategy to a structural change strategy. The best example of that is the SALT program. We reduced our national salt intake in 6 years through a reformulation program. In my view, that is the most successful nutrition policy in the United Kingdom since the Second World War. That is to say, since we had rationing. For those of you who don't realize it, rationing is extremely good for your health, but it's unpopular politically. But the SALT program was the second best thing we've had. And now we have, as been mentioned already, the the childhood obesity plan, which is focused on reducing the sugar content of 9 popular sweet food categories, which happily are not just consumed by children, they're consumed by adults as well. The second way we've begun to change is we've begun to take an interest in price. When I had to read all those nutrition reports, there was never a mention of the price of food. Nutritionists weren't interested in the price of food. Everybody else in the food chains calculates the price of food down to quarters of a penny, but nutritionists did never want to know. They never mentioned it. Happily, we've had a change. It pains me to say a good word about George Osborne, but the soft drinks industry levy, the sugary drinks tax, is a great success. And the reason why it's been a great success, 2 reasons why. Unlike Mexico, Fiji, Hungary, France, George Osborne put in a graduated tax, now being copied in France again. So there are levels. Secondly, he took the softest target because soft drinks are the area where sweeteners are easily workable, and so it was the easy win, the low-hanging fruit. But if you think of the logic behind what was going on, it's an important one for nutrition strategy. Create a price differential between the healthier and the less healthy options. Give people economic incentives as well as moral injunctions. Don't just wag your finger at it, make it worth their while. In April, when this tax becomes formal, it's going to be declared a great, great success. We know that already, because the vast majority of products, and Julian can talk about this because he's doing it all the day, have been reformulated already. Even AG Bar, the most recalcitrant of companies I've ever dealt with in 30 years in nutrition policy, is reformulating Iron Brew and Tizer. Coca-Cola is going to have two major brands that are full sugar paying the tax: Mountain Dew and Coca-Cola Red. Very few. There are going to be very few products that will be fully taxed on the British market come next April. This is a remarkably effective nutrition policy. What it's going to lead to, and you can anticipate it right now, you can write the script for all the health advocacy groups. If it's worked on soft drink, let's apply it elsewhere. Another category, not just soft drinks, biscuits, croissants, whatever. Or, if you believe the Institute of Fiscal Studies, on sugar itself. Right? But you're going to have demands for more taxes on bad foods, quote unquote. The third thing that's changed dramatically in recent years is a recognition of the implications of diabetes. What we have following on behind an obesity epidemic is an epidemic in diabetes, which is affecting people, children very young, as early as 7, 8, 9 down in the West Country study, but increasing proportions of the population becoming diabetic or pre-diabetic, badly measured, inadequate research. Nonetheless, we can see a clear trend and a clear threat. Diabetes is an extremely expensive disease to treat, especially if you're doing it from a young age. You're talking about amputations, you're talking about blindness, you're talking about drugs for a lifetime, you're talking about repeat visits to hospitals and GPs. If we had diabetes on epidemic proportions, it would break the bank of any healthcare system in the world, no matter how it's funded. It would be the end of the NHS. That gives some urgency to nutrition policy, and particularly to sugar policy. Diabetes gives me cause for black optimism. It's going to make things so bad that we're actually going to have to do something about the problems. This is going to be a squeeze on the food service industry. Already many times mentioned already today. The intra-industry squabble. Manufacturers and the retailers think you're getting off light, right? But attention is already turning to the out-of-home sector. The next challenge for Public Health England is calorie reduction. And what are the products? Burgers, pizzas, sandwiches, crisps. The 4 foundation stones of the out-of-home sector. Thereafter, in a different way, not sugar, but calories appropriately, but this is a focus on the food service industry. The second big indicator is the Scottish obesity policy. Just went out for consultation last month. It promises a distinctive strategy for the out-of-home sector by the middle of next year. A commitment to write that. We don't know what it's going to contain, but clearly in Scotland, the out-of-home sector is a focus for particular nutritional attention. Of course, during all of this, the out-of-home sector has not been idle. We've had mentioned today contributions from individual companies who are doing progressive things on many parts of their work program. I've had personal experience with Compass, with Brakes, with Sodexo, with McDonald's on progressive policies, quite radical progressive policies. The big companies are not sitting back and doing nothing. The accusations for them are unfair. And we've seen, just in Footprint itself, a set of reports setting out programs. Amy was talking about the next one, but we've had 3 already, on chef training, on nudge strategies within restaurants, and importantly on reformulation, how to go about it. And we've got another one coming. Good. Not idle. Accusations are not fair. But it's clear from what's happening that the out-of-home sector is now a target, just like the manufacturing and retail sectors, and you must be prepared for more attention. And it's going to come in 2 ways that haven't been particularly the focus heretofore, but haven't been particularly mentioned today, right? One is attention to the price of your goods, and secondly, specifically to the sugar in them. Let's take price, particularly the form of promotional offers or discounts. In the Scottish obesity policy, that is the #1 target. We want to do something about promotional discounts on unhealthy food. It is also, if any of you attended, Action on Sugar's meeting, Victoria Target, Jack's boss, got up allegedly to talk about sugar. In fact, all she talked about was promotional discounts. It's a focus of attention in England and in Scotland. In Scotland, it's a firm commitment, and we've just had, in the past week, an indicator that it will be a real action, right? Because the Supreme Court is just after 5 years given the go-ahead for minimum unit pricing on alcohol. It's a model. It's one option. Needn't stop at alcohol, it can go on to other things. Minimum unit pricing on something else. Also in that document, worth reading, she talks about the retail standard that has been applied in NHS establishments. By the retail standard, she means what products can be stocked and what prices they can be sold at. The obvious option for the Scottish Eileen Campbell, the Scottish Health Minister, is extend the retail standard to all public sector catering operations. Control of what you stock and what price you sell it at. She could take up what is the French SRP, or in English, the threshold for resale at a loss, which is a law in France which has just been renewed, acceptable in the EU to control loss leaders. She could support an extension of the sugar tax. I don't know what she's going to do, but price action on discounts is her #1 target, and she's got a lot of options available to her, and I suspect she's going to do something, and you're going to feel it. The mention of sugar tax leads on to sugar, particularly. In the footprint guide on reformulation, you quite properly focused on the whole food, not on single nutrients, and that's come up again in this talk. Yes, I agree. But we know, everyone knows, just as citizens, not as people in the food industry, that sugar has suddenly become the principal nutrient of concern, not just in the UK, but all over the world. And an obsessive focus in some ways, a destructive focus in many ways. It's too selective, disproportionate attention, but the result is pressure on companies like yours, and manufacturers and retailers, on the food industry altogether. And, as someone said, there is a case to be made about sugar. We certainly eat too much of it, right? And we suffer many expensive diseases as a result. Of which diabetes is just one. And so the out-of-home sector can expect some action on sugar sooner or later, specifically for you. In this, and I'll conclude by maybe slightly more than 90 seconds, the government is actually not being very helpful to you or to anyone on sugar. It's not being helpful to public health advocates or to to industry. What we have is two programs, the sugary drinks tax and the childhood obesity plan reformulation. But last month, on the 1st of October, we finally completed the reform of the EU sugar regime, which was enthusiastically supported by DEFRA. What that meant was the removal of production quotas and minimum support prices on both sugar beet and on isoglucose. Isoglucose is Euro speak for high fructose corn syrup. The effects on this are going to be, in the very first year, by spring of next year, a rapid increase in the production of sugar, 22% in the latest predictions all over Europe, but highest of all in the UK, 44% by next year. And that's without taking into account the fact that the UK is going to be the basis for the one new sugar refinery being built in Europe, Alcalige's plant, intended for Yorkshire, which, if critics are to believe, is going to be the biggest in the world and will be as big as what British Sugar is going to do. If that goes through and the planning application goes in this month, what it's going to mean is that UK sugar production will have trebled within 5 years. And this will mean a lower price for sugar. All the predictions before the sugar regime came off was that European prices for sugar, world prices would converge, but that European sugar would have a premium. And the premium was estimated in DEFRA at 15%. Already in 2016, before they even came off, European prices were below world prices, however you measure them, in New York and London, right? This is the single most unhealthy sugar policy you could ever possibly design, right? But it's worse than that. What it does is show the contradictions within the government. Here we have DEFRA trying to raise the production of sugar, while Public Health England is trying to lower its consumption. We have DEFRA lowering the price of sugar, while the Treasury is trying to raise the price of sugar. This undermines not only public health, it undermines or contradicts industry's attempts at reformulation. We're making more and cheaper sugar available just at a time when we need to be eating less. If you think of this from the perspective not of the boardroom who's saying, I agree, but the food technologist who has to do the reformulation, the target, the brief for the reformulation isn't just reduce the sugar, maintain the taste at least as good as everyone else wants, keep the shelf life up, ease of manufacturing, and it mustn't cost more, or hopefully make it cost less. In that context, cheap sugar, below world prices, below anything they've ever seen before, is going to undermine efforts at reformulation. I do have solutions for this. Public critics should say what they would do instead, but I've run out of time, so we'll save that for discussion.
Well, thank you very much.